It's very unfortunate we have this incident and the waste of very precious life, and we pray may her soul rest in perfect peace. Issue of snake bites should be treated as a medical emergency, irrespective of the type of snake. First and foremost, it's a waste of time to start thinking, which type of snake has bitten somebody. So there are two things that do happen when people find out that they have been bitten by a snake. In several cases, people don't even know that it is a snake that has bitten them, because the bite is usually like a prick of a needle, and until the envenoming starts spreading before you know that it is not a simple pricking from a needle or a stick. So it's a bite. So in the cases that somebody does not see the snake that has bitten him or her, they don't panic. But if, like in the case of Ifi, when she woke up and realized that she had the pain at the site of bite and saw the snake, it will immediately send a state of panicking into her mind, and she will be, doing things that she's not supposed to do, that will facilitate the quick, circulation of the venom into the system. The snakes, they have these venoms, not just for fighting or defense. That is their means of feeding. When we want to eat food, we get our food, we cook it, we process the food and eat. They swallow their own food raw, and it is the venom that they inject most of the time into their prey that inactivates the prey and also help them to digest, that food that they have eaten. So venom for them is very important, and for us is real serious medical emergency. So if somebody is bitten by a snake and he's aware that a snake has bitten him, the more he moves, the more the venom circulates in the body. And that's why one of the first things to do is to immobilize the site this snake has bitten a person, and then minimize movement, and if possible, if you can get people to help, to carry you or her, to a medical establishment. Often than not, we quickly rush, we panic, we tie the extremities where the snake has bitten, thinking that that will limit the circulation of the antivenom. In some of the snakes, like the carpet viper, the more you tie, the worse it is for the person that is bitten, because the poison will still circulate, and then if it passes the area into full blood circulation, it can cause more severe envenoming with all the consequences. So the first thing to do is minimize panicking, and start thinking of how to reach a medical establishment for treatment.